Welcome to today's episode of Peer2Peer The Podcast. We're here in beautiful Italy at Ophthalpreneurs 2025. Welcome both of you. This meeting is all about enhancing the patient experience in premium clinics, making it the ideal backdrop to dive deep into the importance topic of PROMs, or patient-reported outcome measures. I'm thrilled to be joined today by two incredible experts. We have Mr. Sheraz Daya, a pioneer in ophthalmic surgery and innovation, and Ms. Pei-Fen Lin, a consultant surgeon and researcher specializing in PROMs. So we couldn't have two better people to talk on the topic. Thank you both for coming.
Thank you.
So Pei, can you start by telling us what are PROMs?
So PROMs, as you said already, stands for patient-reported outcome measures. But for me, to define it it's how we should be measuring our performance. So to draw a parallel to the airline industry, that does it very well. As surgeons, we often are very proud to say, the lowest complications, we have lowest infection rate, our hospital is the cleanest. You never hear an airline advertise their service saying we have the lowest crash rate.
That's true.
And so I think PROMs is a way to measure good things about our practice, also monitor bad things, but from the patient's eyes, through their lens. When we do a cataract surgery, we should be measuring PROMs more and actually using their opinion of how we improve patient life in the real world for a procedure or service that we provide. But we don't do it very well at the moment.
We don't?
Well, we still measure how clean our hospitals are.
So literally looking through the patient's lens. I like it.
Ooh,
No puns
that's a
intended.
good one.
Yeah, that's good. That's good. Sheraz, what's your experience with PROMs in clinical practice?
So we have had reviews rather than PROMs, and what we've tried to do is understand from patients about meeting their expectations and how satisfied they are with their treatment. So we've used established PROMs like CatQuest, for instance, to measure beforehand and afterwards. And because we do lens replacement surgery, which is refractive surgery, their expectations are higher, and what we promise is a lot more than regular cataract surgery. How would we know that we're meeting up with those expectations if we didn't ask patients? So we've been doing this for decades, but it's been a laborious process, and you don't always get the returns. You got to sometimes chase patients to fill out forms, and there has to be a simpler way.
Yeah. And Pei, you're saying that we're not good at PROMs. Can you tell us about your research and your findings to do with PROMs?
So, like Sheraz said, PROMs is a well-established tool already, but collecting data has been the biggest barrier. So at our hospital, we try to find a way to collect PROMs. Traditionally, you collect it with paper. Clinicians do it because we have to do it for the national audit program. You do 50, which is the minimum. You put it out and you choose 50 patients that you can finally find and track down.
The best patients.
The best patients.
So you pick your responders.
Exactly.
Yeah.
And you do it once a year, and you do your homework with a nod, and that's it. And that's useless data because it's not really related to anything that you can think to improve. We don't do it very well because it's tedious to do it. We don't like to do it when we have to do it. So when we did a project on researching what platform that we can use digitally to facilitate that, we compared the normal paper collection method to a well-established platform that has demonstrated superior analytic data collection in the palliative care. And then we thought, this would be an easy option. They're established, they're experienced, how hard could it be? But what we found is the onboarding process for the team, for the actual clinical team, was so laborious. It took, I think, within a year and a half, with one dedicated registrar phoning individual patients up. For a year, we had 80 replies.
Over a whole year?
Over a whole year.
Yeah, that's not great.
And we do about 3,000. So cataracts, so that's terrible. And also with the cataract patient, what we found is in palliative care, patients are engaged. They're long-term chronic problems. So they are actively, once you onboard them on a platform like that, they're actively engaging, they use it all the time. With cataract surgery, once we fix their problem, they're gone.
Yeah.
They're gone.
You don't want to retain patients.
Yes, and the patients don't feel they need to reply anymore because the problem is solved. I now have to do this extra thing for my doctor, and they don't do it, and we chase them. So we found that actually this third platform we found that was very useful, that to get data back, not so high on the analytic, but to get data back, was a really well-designed patient-facing platform called Doctor, but they don't do any analytics. They're not specialists in PROMs collection. They're just a patient engaging messaging service. And we found that within, from 4% on paper, 12% with the palliative care.
It's a big improvement.
It's a big one. But with the new platform, 46%.
Oh, wow, that's huge.
So it's actually, once you get the data back, you can do analytics if you want, whenever you want. So I think what we learned about collecting PROMs is that you must find something that to get the data back effectively without the surgeon need to be involved at all.
Yeah. I think that's one of the off-putting things is the thought of doing more work.
Yeah.
Yeah.
Well, I think also if patients so we found that when we were asking patients questions, they got suspicious. Is there something wrong? Is there been a recall on my implant?
Why?
Exactly. Why are you asking me these questions? You've discharged me. Why 3 months from now, why are you asking me the questions? So we plan them beforehand. We prep them up and say, you will get, this is a questionnaire you got to do, we'd like you to do now. You'll get a questionnaire later too. And in the case of RayPRO, you'll get it on your phone. It'll be a reminder. We really appreciate it if you could fill it out, because it helps us understand if we're meeting your expectations and so on. Then they're okay with it.
Yeah, most patients want to help, I find. Maybe it's different in the UK, but in general, people are helpful people.
Australians aren't too suspicious then.
Maybe not quite as suspicious as you. Sheraz, how have PROMs actually impacted your clinical practice?
I think it gives us, well, for me personally, it reassures me that I'm doing the right thing. And it's great to have the data there, but I have to say I've got to couch it with all those biases that we addressed earlier on. But if I've got data in the 90s percentiles, I'll take that. I think it's really good. We all, as surgeons, are perfectionists, in ophthalmology in particular. We want 100%. And so the question is, why aren't we getting 100%? And so you move from 95 to 96 and then 95 again. That's not significant. But so we have to accept the fact that we can't be completely perfect. And I suppose patients might wonder why we're 95% and not 100% too. So it depends how that data is used and what you say about it. But they're the biases. But I think for me it's been very useful. It's reassuring with RayPRO. We use these trifocal lenses in an effort to make patients independent, and we find that in the high 90s, patients are independent and satisfied. 98th percentile with toric lenses. It makes me realize that actually maybe I should be doing toric lenses more often than doing LRIs, for instance. But I need to take a look at that in more detail, because I only do torics for above 1.25 diopters. Is it because they got low myops, or is it because they had a big change and made them even more satisfied because they got rid of the signal? So there are a few things that we need to understand, but it's useful. It's actually raised the questions. So when we see it, the question is why, and it's worth investigating.
Now, we've talked about PROMs. I'd like to talk about RayPRO itself. Both of you have used it. As an expert in PROMs, what do you like about it?
So I've just started using RayPRO, and I think what I love about it is just I don't need to be very involved, which is, I know it's I think my pet passion for digital innovation is things must be designed from a design thinking point of view, what the user journey demands. So a lot of technology out there at the moment is designed on what data I could get back, and they forget actually the user is the person putting the data in. And so what I love about RayPRO is actually it's designed from the user point of view. It will help me get the data back effectively without me doing very much, which is what I need, because I don't, like you said, I don't have time in my clinic to do another onboarding, to do another piece of paperwork, however important it is, however mandated it is. I may do it for the first 2 patients, but if the onboarding is too hard, I'm pretty sure the rest of the clinic and the rest of the week, I'm not doing it.
Yeah.
Without RayPRO, it made it easy for me to collect data. And then it automatically sends a reminder for the patient. It collects the data in a set time frame that according to research, which means that the data you collect back is cleaner, more effective, and is organized in a way that I can use it to evaluate my practice and where should I change. And so it's useful data. Unlike the paper, it's just a piece of homework I hand back to Nod every year.
Yeah. That's good. And Sheraz, we were speaking earlier about you feeling like RayPRO maybe helped with avoiding staff burnout from doing all these tasks. Are there any other aspects apart from what Pei obviously just said?
That's right. I think that's well, we're all experiencing this all over the world, especially in the industrialized world, where patients are getting older, a lot more patients. We're expected to do a lot more in less time. And my philosophy is that, certainly us as ophthalmologists, we should be concentrating on doing where our value is, which is to diagnose patients and to treat them, whether it be medically or surgically. We shouldn't be spending time on any trivial pursuits that can be done by technology or people, but hopefully less people and more technology. And I think that's going to be the savior of our burnout. It's going to help us have a much more fulfilling job where we go home feeling accomplished and not bothered by all the noise in the system and the admin that's surrounding us based on regulation and all the quangos that are out there tormenting us. So I think that if we can go back to the basics and we can be doctors, look after patients.
Do what you do best.
All the other stuff done by others or done digitally and seamlessly. That's fantastic. Where we just get the stuff. We're not sitting there prodding people to get on with it.
And Pei, I think the answer to this is going to be just to use RayPRO. Yes. But how can we improve our response rates? You spoke about very low response rates when you started collecting PROMs, and they're getting better. Anyone out there that's wanting to collect PROMs, from your expert opinion, how do we increase that response rate and the quality of what we get back?
So I think choosing the right platform, so a platform that's easy to use like RayPRO is key. Once you get the platform that suits your practice, so you will have a base of collection, you know where you start from. So I think the benchmark in the UK, it's about 32%. It's a good response rate, which may sound very low.
It sounds very low.
But it's actually pretty good.
45%.
But yeah, so RayPRO is actually already 45%. So against the normal benchmark, it's already a lot better. But you can actually there's some research out there saying if you just prompt somebody again within a week, and you can bump that up to 10-15% on top. Okay. You can get, if you can get over 55%, that is better than any surveys out there for any company anyway. Yeah. So we can't be too critical. I think, getting 98 response rate back, that's not possible. Ridiculous in any industry. So, but actually 46, almost 50%, it's a very good start already. You can bump that up by gentle reminders. And you don't want to go into, incentivizing, otherwise you get really biased data, which is not clean. But actually...
You don't know them either, because they'll just resentfully fill out the form and give you a bad score.
Exactly.
Surely once you've operated on them, they're gone, it's fine. But I suppose you don't want a bad Google review either. You don't want to annoy a patient.
Yeah, and then so they say, yes, my vision are brilliant, but this app is so annoying. You also don't want that.
Well, they have so much contact. It's amazing. The number of reminders and notifications that they get about everything under the sun. For us to add to it, it might just be the last straw.
That's true. And Pei, you've started using RayPRO in your private practice just recently.
Yeah.
We spoke about onboarding seems relatively easy. Have you found the process of integrating with your team, getting started with it, okay? Like it hasn't been arduous for you?
No, and I think because I had experience of very difficult platforms before.
I was going to say, if anyone's starting with PROMs, you are the world expert. So
this was
a piece of cake.
Much easier. So, I think for private practice, it has really helped my team to understand why we need it as well. And because it's not an extra thing they do, they just attach it to, the clinic letters or the phone call they make. And because it's not arduous, they find it quite easy to do, which is a relief for me, because if they can do it, it means I don't need to get involved.
And Pei, what is the future of PROMs in ophthalmology? I hope you're going to say they're not going to be existing.
She's going to change her research topic.
Yeah.
It's done.
We've clocked PROMs now. They're done, yeah.
I think the future of any healthcare is going to become more value-based. And I think Harvard Business School defines value-based. What value means is value should be the outcome that patient care about over your cost.
Yeah. Well, thank you both very much for joining me, experts in PROMs and eye surgery. I think...
I like it the other way around. Eye surgery first.
Okay, fair enough. I think the key take-home message from me would be PROMs is beneficial to your practice, to your patients, to your outcomes, and it's not that hard to do. Do you think that's fair?
Yeah, and there's not now a question of whether it should be done, it must be done.
Yeah. Well, thank you both very much, and enjoy the rest of your time in Italy.
You too.
You
Thank
too.
you.
Thank you.
Ciao.
That's it.